Hey manual therapy friends, it's Dr. David here, and we're covering this for these few weeks here, how to help somebody who's got a sciatica problem using manual therapy techniques. This is your manual therapy skills for Thursday. So what I'm going to be doing today is a SI joint mobilization that we call an iliac inflare or an iliac outflare. So this is some deep cuts here. This is some advanced manual therapy stuff. But let me just tell you the concept here. Of course, SI joints are weird joints. They're propeller shaped. They're shaped like that, and they're kind of not really in the sagittal plane. They're kind of between sagittal and frontal plane, and then they're angled down as well. So they're awkward joints, and they have awkward mechanics as well. I won't get into that. That's a whole other confusing long story. But what you would have to identify here is if the iliac on one side is shifted out or shifted in, because that can happen. And if you can correct that, you can make a huge difference in somebody's back pain or sciatica pain or hip pain as well. Because of course, if that iliac bone shifts out, it's going to change the position of the acetabulum for the hip, and can mess up the hip function and create some pain and dysfunction. It can mess up with the muscles that attach in the area as well. It changes the tension through the muscles, tensions nerves. It can cause all kinds of problems. So let's assume here that we found that Kevin has an iliac problem on the left. If it is shoved out, you simply want to shove it back in. And if it's shoved in, you want to yank it back out. But here's how it looks. You have the patient lie down on their side, of course, head supported up there, and I usually have them bend 90 at the hips and knees, just for stability, because if they're straighten out your legs here, it's a lot easier for them to kind of roll forward and back. But go ahead and bend them back again. Now it's harder. He's going to feel more stable, so he's going to feel more comfortable. Now I'll leave some space behind them on the table here, because I like to get my knee up against their lower back here, kind of sacrum, lower back area. And that way I can get some good leverage and give them more comfort from here as well. Then what I do is I find the borders of the iliac crest and ASIS, line up my force, and I can start to mobilize. Word of caution, you're right next to the TFL muscle right here, which can often get quite irritated. So you want to be careful when you're pushing here. Check with the patient, make sure that it's not going to aggravate them. You could just shift your hand placement to make sure that you're off the TFL, or you might just spread your force a bit more to not make it so pinpointed on the TFL. Now what I'm doing here is I'm assessing, and I'm beginning to find what's grade 1, 2, 3, 4, and I'm not going to manipulate from here. There's other ways to manipulate the SI joint, which you might do for an inflare and outflare, but we're just talking about mobilizing today. So I'm grasping, you can see I'm kind of wrapping my fingers around the ASIS a bit, and when I push, I'm kind of doing this kind of a motion. This is my stabilizing hand. Sometimes I'll put it over, but it's actually on his greater trochanter, and I use it for feedback. I can feel his greater trochanter moving kind of in this direction as well, so it's telling me that I'm moving his iliac properly. And I'm giving him about a grade 2 or 3. If I go into a grade 4, you okay with me pushing harder? I line it up more and I mobilize just like that. So that would be for an inflare mobilization, which is to correct an outflare. But let's say I want to go the other way. This one gets a little bit uncomfortable for the patient, so you just got to be careful. Now he's got a thick belt on, so if it obstructs, I definitely ask the patient to take off the belt just so we can be on their clothes that are softer. But it's actually okay for me. I'm going to be able to get around it just fine. So what I'm doing here is I found his iliac crest and ASIS, and I'm gonna put my fingers on just like this, so fingers over fingers. And what that helps me do is I'm pressing with my right hand through my left fingers, just so that it's not so pokey. It kind of uses my left fingers as padding, and I'm using my right fingers as the force drivers. So I'm gonna grab right there and lean back. I'm doing this with my body and hanging on so that I pull. And I'm using the same grades, 1, 2, 3, 4. So hooking on there. And I'm not going to go through as much motion as I was demonstrating, but that's kind of the direction that I'm going. And what the patient will often feel if they've got a real bad SI joint problem is some relief back there, especially if you have it in the right direction, if you're mobilizing in the correct direction. And you just hang out there. The common problem people run into with this is it gets really tender and pokey right where you're feeling. So you have to kind of spread your force, do different things with your hands, find what works the best to get that mobilization in. Now, if you have extra tissue in this area, you can still get onto the iliac crest. You just have to push through extra tissue. It's no big deal. Kevin's nice and slender here, so I can feel every bone just fine. But with extra tissue in the area, it might just be a little bit more sensitive. You just have to kind of deflect it, push it away, and get over that ASIs to get the mobilization technique in. So I hope this helps you out. If you have any questions about this manual therapy Thursday on how to do that Inflare, Outflare mobilization, just hit us up, hit the comment button, or hit the comment, make a comment, I'm so sorry, and let us know what you think about this technique. Let us know if you've ever seen this or if you ever do this technique, and if it's something that you might start to implement in the clinic for your SI joint, lower back pain, or sciatica patients. I hope you have the best day. Bye-bye.